So in this video, we're going to be looking at the regulation of the cardiac cycle. So we've learned the sequence of the cardiac cycle. So let's talk a little bit about how it is regulated. So there is two kind of innervation that serves the heart. There's parasympathetic innervation and sympathetic innervation. So these are both autonomic regulation of the heart. And if you recall, sympathetic, that is the fight or flight division, while parasympathetic is rest and digest. So we'll first start by talking about parasympathetic control. And it is provided by a branch of the vagus nerve. That is that's the cranial nerve that innervates much of the abdominopelvic cavity organs. And it's the neurotransmitter that's used for parasympathetic control is acetylcholine. And so we have a constant kind of low-level break on the heart rate at both the SA and the AV nodes. So there's this constant dribble of control telling the heart to slow down the heart rate and the force with which the heart beats. So if you increase parasympathetic stimulation, then that's going to slow the heart down even further. But if you decrease the amount of parasympathetic stimulation that's coming, if you decrease this low-level break on the heart's rate, then you can speed up heart rate. So we got one system that will constantly can be used to both speed up and slow down heart rate, which is kind of a strange setup, but this gives us a little bit more fine control in how rapidly the heart should be beating. Sympathetic innervation, okay, this is fight or flight innervation, is provided by the accelerator nerves that are coming from the cardiac centers of the medulla oblongata. So this is coming from the spinal cord rather than or from the brain stem rather than directly from the cerebrum. The neurotransmitter that's used is norepinephrine. Norepinephrine is a cousin to, it's very similar to epinephrine in its effects. So epinephrine. So we think about norepinephrine and epinephrine both as neurotransmitters that tend to be about driving the body into fight or flight. And so sympathetic stimulation serves to increase the heart rate in this fight or flight response that we can have. So how then do we make use of these two systems to control the heart? Well, regulation is initiated by reflexes, and the reflexes are mediated by the cardiac center. And so the job then of the cardiac center that's found there in the medulla oblongata is to integrate and balance the controls that are coming from both sympathetic and parasympathetic stimulation. And so we have two centers. There's the cardio-inhibitor reflex center, and the role that it plays then is to slow heart rate and force, while the cardio-accelerator reflex center increases or speeds up heart rate and force. So here are some of the reflexes that are involved in regulating heart rate. The first is provided by baroreceptors. Baroreceptors are found in the aortic arch, in the carotid arteries, and in the inferior and superior vena cava. And they sense blood pressure. That's what baroreceptors do, is that they are stretch receptors, and they notice when blood pressure is stretching the tissues in which they are embedded. So if there's an increase in blood pressure, then we see stretch at the baroreceptor, and this will then lead to stimulation from the cardio-inhibitor reflex center, As a result, we increase parasympathetic stimulation, which slows heart rate, causing less blood to be pushed from the heart. And so if you're pushing out less blood, that will have the functional effect of reducing blood pressure. Imagine turning your faucet toward off. That would be the idea. You're pushing out less fluid, and as a result, there's less pressure in the system. If, on the other hand, we see, and this is interesting, this kind of stimulation is what's happening on the arterial side. So this is if the aortic arch or the carotid arteries are found in the neck, they're serving the brain. So when we're sensing blood pressure at the aortic arch and the carotid arteries, we're getting the major, the most important places covered. So that's, if we see increase on the arterial side, we see these effects here. If, on the other hand, there is increase in blood pressure on the venous side of the heart, so if we notice at the superior and inferior vena cava that there is an increase in blood pressure, the goal, or the way that we can reduce that increased blood pressure and bring the body back into homeostasis is to get the blood out of the venous side. So while it seems a little counterintuitive based on what we just talked about for arterial side control, it makes some sense if you think it through. So blood pressure is increased at the vena cava, both superior and inferior, and we want to clear that blood that's clogging up the vena cava out. And so the way to do that would be to have stimulation from the cardioaccelerator reflex center. So we notice stretch there in the vena cava. That triggers then a reflexive response where the cardioaccelerator reflex center sends out sympathetic stimulation. The heart begins to beat more quickly, and that moves the blood out of the vena cava and into the arterial side of the heart. And so that would then result in decreased blood pressure in the vena cava. So if there's increased blood pressure on the arterial side, the solution is to slow down the heart. If there's increased pressure on the venous side, the solution is to speed up the heart and get that blood out of the venous side of the heart, or of the pathways. So there are other ways or other systems that can stimulate or cause changes in the cardiac cycle. So strong emotions and distress can lead to stimulation of the autonomic nervous system, depending on what the emotions are. If it's anger, then that could cause an increase. If we're seeing depressed characteristics coming from the brain, then that may cause a reduction in activity. Body temperature, so when a person is spiking a fever, that can result in increased heart rate. We see sympathetic stimulation increasing heart rate. Whereas if a person is hypothermic, then we'll see slowed heart rate, so an increase in parasympathetic stimulation. And then ion concentrations in body fluids can also affect the action potentials that are being sent in cardiac muscle and the heart rate. So hyperkalemia, that cal, that's the reason why potassium has a K in the name, or in its its symbol is K, is because the old Greek term for potassium included this cal term. So hyperkalemia is high potassium, that causes decreased heart rate and force, whereas hypokalemia, that would be, that should say low potassium, LOW, sorry about that. Low potassium can result in arrhythmias. Hypercalcemia, that's high calcium, will cause increased heart rate and force, while hypocalcemia will cause a decreased heart rate and force. And we will wrap up here then. Oh, nope, almost. So some issues related to heart rate and heartbeat. Bradycardia is a slow heart rate Anything less than 60 beats per minute is considered bradycardia. Sometimes bradycardia can be very adaptive and even a good thing. People who do a lot of athletic work will exhibit bradycardia. Can have pulse rates that are down around in the low 50s, high 40s even, if they're like really, really well conditioned. Tachycardia is rapid heart rate, that is anything that's greater than about 100 beats per minute. And fibrillation occurs when we have uncontrolled stimulation coming from multiple locations, especially in the atria. That's atrial fibrillation tends to be a problem as we age, especially. And then there are some other clinical issues that are there in the book as well for you to look through. Okay, so that's everything I've got to say about this chapter. If you have any questions, you know how to reach me.